So good afternoon. This is Carolyn Garofalo, and I'm going to run you through the PowerPoint presentation today. I'm here with Rich Hunter and Tom Burke, and collectively we will try to answer your questions at the end of the webinar as well. So again, if you have a question, go ahead, type it in, and we'll open for live questions at the end. So, here we go. Hopefully by now, each of you have had an opportunity to take a look at the announcement in the Grants Gateway, read through it, and get familiar with the program. And you also have had the opportunity to start a Grants Gateway account if you've not done so yet. However, that's not a problem. We will go through some of those steps as well today. So a little bit of a background on the program. The New York State Doctors Across New York initiative includes several programs collectively designed to help train and place physicians in underserved communities. The programs make funds available to help recruit and retain physicians to work in the medically underserved areas of New York State. Funding is provided in exchange for a physician's commitment to work in an underserved area for a 3-year commitment, and that is consistent for all the awards. So the key dates that you need to be aware of, first and foremost, is when questions are due, and you are free to submit questions from now until February 21st, 2019. At that time, I will gather all the questions together, formulate answers, and we will post the questions and answers collectively on February 28th for all to see. At that time, the next important date you'll be seeing is March 7th, and that is when the opportunity will open in the gateway. So you're not actually allowed to begin applying until March 7th, and you'll have from that date until April 4th to complete your application. So the application start date on March 7th, it will begin at 9 a.m. You'll be able to access the Grants Gateway starting in that hour and begin your application. We encourage you to do it as soon as possible. Please do not wait till April 4th to start your application. Chances are you may run into some issues with the gateway or timing out, and we just really don't want to see anyone have difficulty. So please start as soon as possible. All questions that we're collecting should be sent to us to our email address that we'll discuss later on. We encourage questions in writing, and please do not call with questions. It makes our response time more difficult, so keep that in mind. Again, the submission deadline is 4 o'clock on April 4th, so please be mindful of that hour. The gateway does close automatically at 4 o'clock, so if you're in the process of pressing send or finishing an application and it's 4:01 or 4:02, it will not allow you to continue. Key dates continued. So again, program-specific questions are due by February 21st, and this is the email address to where you're going to want to send your questions. Please note that I will not be sending you an immediate response, but all questions will be answered at the same time. After February 21st, the department will only be able to answer technical questions. So that means we can tell you how to find the opportunity in the gateway. We can answer questions about maybe what the due date is. But if you have particular questions about the RFA or about any specifics therein, after the 21st of February, we're not able to answer those questions. So please gather your information promptly. So who may apply? There are 2 types of applicants for this particular opportunity. The most popular type of applicant is an individual physician. However, we also have healthcare facilities that apply, and you have to be one of these 4 healthcare facilities to apply for this grant. So either a general hospital, DT&C, or nursing home licensed by the department, a facility certified but not operated by the Office of Mental Health, a facility licensed but not operated by the Office of Alcoholism and Substance Abuse, or a private medical practice registered in New York State as a PC or a PLLC. The most frequent question we see is, should I register as an individual or a facility? And there is no benefit to doing one or the other. All of the applications are taken at date and time order in the gateway. So the only advantage to registering as a facility is that a facility may have a grants coordinator who's familiar with Grants Gateway and navigating the system, and that might assist you in your process. Another frequent question is, if I work for a federally run veteran facility, am I eligible? And no, you are not. And I will make one specification because it came up very frequently in the last RFA. If you're a physician employed at Rikers Island, this is the only caveat that I will say. It is important that you register as an individual physician working at that facility and not a healthcare facility registering a physician at that location, because Rikers Island is not one of those 4 application types. So again, if you work at Rikers Island, you're going to want to register as an individual physician. The use of funds. The 3 main use of funds are to repay qualified educational debt, and that is by far the most popular type of applicant. You also can use the funds to support a physician to establish or join a medical practice. And thirdly, to help a healthcare facility recruit or retain a physician. If you are using the funds for qualified educational debt, the loans can be graduate or undergraduate loans. The loans must be made in your individual name. And we also often get questions about refinancing. You can have a refinanced loan as long as it still qualifies as an educational loan. So if you refinance into a HELOC, that's not eligible. But if you refinance and you consolidate your educational loans, they are still eligible. I will say some information about number 3, healthcare facilities to recruit or retain a physician. It's important to note, and in the RFA it does stress this, that if you're a facility and you're using the money for a sign-on, productivity, or retention bonus, this is not to be meant, the funds are not meant to be used as a bonus offset. So the bonuses that are to be paid out are additional funds going to that physician. The same thing with enhanced compensation. The grant money is not meant to be an offset. So the money given to the physician would be above and beyond what would have been received prior to the DANY award. And that's something we can clarify later on. Application limits are a little bit different this time. No more than 1 application will be accepted from a single physician, and that is the same. But no more than 3 applications will be accepted from a healthcare facility. In the last cycle, that number was 2. So that does allow for some more leniency in the application process. Again, if you're a healthcare facility, we're looking at healthcare facilities with the same operating certificate number or medical practice with the same Department of State identification number, and that's how we track our limits. So the 3 application limit will apply regardless of whether the application is submitted by a physician or a healthcare facility. In either case, if more than the number of allowed applications are submitted, only the first applications received will be eligible for award and reviewed. And I know this is a bit confusing. So on the next page, we'll lay that out to you a little more clearly. So for example, if XYZ Hospital submits 3 applications for physicians at their facility, and in addition, Dr. A, who works at XYZ facility, also submits an application, that means collectively we now have 4 applications. But no more than 3 awards can be made to support a DANY service obligation to be carried out at the same healthcare facility. So the department would take the first 3 applications received and review those 3 applications. The RFA will provide up to $40,000 per year for 3 years on behalf of a physician who agrees to practice in an underserved area for a 3-year service obligation. So that max amount would be $120,000 over 3 years. We have up to $9 million in state funding. That should equate to approximately 75 awards for this cycle 6. Some award limits that we adhere to is that 1/3 of the funds are allocated to New York City. 2/3 of the funds are allocated to the rest of the state. No more than 50% of the funds allocated to obligations in general hospitals, or no less than, my apologies. no more than 5% funds allocated to obligations and facilities certified by the Office of Mental Health, and no more than 5% funds allocated to obligations and facilities licensed by OASIS. This slide is important because it helps clarify who is eligible for this cycle. So, physicians cannot have worked in any underserved area prior to June 13th, 2018. And this does not apply to any time as a resident or fellow. And why June 13th is chosen as the date is that was the last closing date for cycle 5. So cycle 6 picks up from that date and goes forward. The physician cannot have an employment contract or business plan at the healthcare facility or practice that begins earlier than June 13th, 2018, or later than November 1st, 2019. So that contract has to be in place prior to the grant start date of November 1st. All grantees will have the same service obligation dates. Everyone will run from November 1st, 2019 until October 30th, 2022. There is an important exception for this cycle that we are making. So physicians who were named in cycle 5 applications, and that application was either waitlisted and not given an award or disapproved, that physician may submit a new application for consideration in cycle 6. And this is the first time we're doing this. For those individuals that fall within this section, physicians cannot have worked in any underserved area between the dates of August 30th, 2010 and August 30th, 2015. So those are the dates for cycle 5. So again, anyone from cycle 5 who was waitlisted, not given an award, or disapproved would have the same look-back period. The physician cannot have an employment contract or business plan at the healthcare facility or practice that began earlier than August 31st, 2015, and later than November 1st, 2019. So this is only the second time the grant is being offered in the Grants Gateway, and I have to say we did pretty good the first go around, so I think we'll find that once you get in and start applying for the application itself, the questions are very straightforward. Please be aware that there are no paper applications that are being accepted. So if you print off the application and mail it to us, it's not going to be taken into consideration. Anyone with potential interest in applying for this program, you really should start the process of applying for a Grants Gateway account now. It can take several days to have that process be completed, and you want to make sure that that's done and handled prior to this grant opening up in the Gateway.
Okay, so yeah, this is Jeff again, and we'll talk about registration and some other things in the Gateway. So all entities that wish to apply for grants in New York State must be registered in the Grants Gateway. That includes you here if you're going to apply for DANY Cycle 6. The process includes filling out and mailing a signed and notarized registration form. So yes, everything in the Gateway is online except for this first part, which is setting up your account or registering your organization or yourself. So there's plenty of information out there for you to get into details on how to register, how to fill out the form and all that. It's really only a one-page form, so it's pretty simple. But we have a website called the Grants Management website, so grantsmanagement.ny.gov. I can bring that up in a few minutes when we get into the live system and just point that out to you. But there's a register your organization page for it, and of course that would walk you through that. And then also at the Grants Gateway itself, there is the Grant Opportunity Portal, and within the portal there's the option to find the registration form and download it from there as well. So it's not just the registration form that you have to fill out, but both individuals and organizations will fill out this same form, the registration form. But another thing you need is an SFS vendor ID. Statewide Financial System is SFS. If you don't have one, there's an additional document that you need to provide, and that's down here in the required for registration that I show here. Like I said, you need the form, but you also need the substitute W-9 form if you don't already have an SFS vendor ID. So if this is your first time ever doing business with New York State, you're going to need that substitute W-9 because you're going to need an SFS vendor ID. The other thing that we ask for, and that's on the instructions also for the registration form, is an organization chart. Well, that's really for organizations, obviously. If you are an individual, we need something, and it's your resume. So we want you to include that. So there's 3 documents you're going to include. Either it's going to be the registration form, the substitute W-9, if you don't have an SFS number, and your org chart, or the registration form, substitute W-9, and your resume, if you're an individual. So again, this takes a little time. Once we receive your registration form, it takes us literally 5 minutes to get you registered. But if you have to submit the W-9 form, that's a good 2-3 days to get that back from SFS to get your SFS vendor ID. So if you do that, again, try to do that well before or in advance of that March 7th date, because you want to hit the ground running on March 7th. You want to have everything ready to go, because it is a first come, first serve the way this works. So pre-qualification is a process that not-for-profit vendors have to go through. That in itself takes, I'd say a couple hours over a couple weeks of work to get it done. You're providing us some documents and some forms, or telling us that you have policies and procedures in place. And when I say it could take a couple weeks, it's because you might have to go find this document somewhere at your organization or request a copy or something like that. So pre-qualification will take, will take some time if you're a not-for-profit. So again, get that started as soon as possible. The good thing about that is you can start your application even before your organization is pre-qualified. They just have to be pre-qualified by the date that the grant is due on April 4th. So again, this only applies for organizations, not individuals. So that might be a benefit of you signing up as an individual instead of through your practice, because individuals do not need to pre-qualify if you're set up in the gateway as an individual. All right, so just through these points, everybody has to be pre-qualified if you're a not-for-profit. The Grants Management website has that pre-qualification information there. You have to be pre-qualified by the due date, and you must be in the status of pre-qualified or pre-qualified open if you're a not-for-profit organization by that due date. There are grantee roles that you need to be aware of. The first role is the Grantee Delegated Administrator, this one here on the bottom left. And when we get your registration form, that's what we set up, and that person can now add or edit user accounts or manage pre-qualification. So if you're a not-for-profit vendor, you're going to work on pre-qualification, but regardless, this person is going to add other user accounts, because this person cannot work on an application. So they're there to manage your account and decide who gets another account. So those other roles are up here in the top left, grantee. This is somebody who can start an application, work on the details of the application, fill it out, save it, but they cannot submit the application to us. So if you're an individual, there's no point in setting up a grantee role. It's not going to help you submit your application. If you're a organization, maybe a larger organization, maybe you have a grant writer or somebody like that that fills it out, but they're not the person that actually submits it, that would be the reason you would have a grantee role. So if you're an individual or an organization, you need to have somebody with the ability to actually submit an application. And that's these two on the right here, the grantee contract signatory or the grantee system administrator. Both of them do pretty much exactly the same thing. They do all the things that the grantee can do. You can start an application, edit an application, save it, but you can also submit the application. So you have to have somebody in one of these two roles on the right, grantee contract signatory, grantee system administrator, to set it up, to actually submit the application. So again, if you're an individual, you'll get an email with an account for grantee delegated administrator. First thing I would do is log in as that account and create a grantee contract signatory, and that'll get you going. And then you'll probably never even touch the grantee delegated admin role again. It's just the way we have it set up, so there's no way around it. You do have to have those two accounts. All right, so just some notes about those roles. Again, your organization must have somebody in the user role that can sign or submit an application. And again, that's grantee contract signatory or grantee system admin. It's perfectly acceptable for the same person to have multiple roles and thus multiple accounts. If you're a small organization, you might be a grantee and a grantee contract signatory, or the grantee delegated admin and the grantee contract signatory. That's fine. You can use the same email address, that's fine too. You can even set them up with the same password. So, but you do need a new account for each role if you want different roles. And like we said, just create one role for yourself if you're an individual physician, and that would be a grantee contract signatory. All right, this brings us back to Carolyn.
Okay, so I will pick up on the review and the award process. So once we receive all your applications, what happens next? So the department will review all the applications in the order that they're received in the gateway. And the gateway will date and time stamp all your applications for you, and we will see them without having to do anything. Again, the earlier that you can submit your application, the better, because it is first come, first serve for the funds available for this grant. We will notify you directly through the email that you have on file whether your application is complete or incomplete. So if you hear from us and we say your application is complete, that means no further action is necessary, but it doesn't mean that you're going to be guaranteed funding. It just means that all the paperwork that we needed to receive from you and all the questions that we needed to have answered have been completed satisfactorily. If the application is incomplete, this is one area that you really do need to pay special attention to. We will send you one email with a list of all the outstanding items that we need to receive from you. The applicant will have one opportunity, one email, to send us back everything that we are requesting, and you will have 10 business days to do so. So from the date and time we send that out to you, please be diligent about making sure you answer each and every question we ask of you and send all those responses back in one email. And the email address, once again, is listed here for your convenience. That is our main method of communication. We will not be able to accept any late submissions. So if you send us something on 15 business days later, that is going to affect the status of your grant application. If you, please make sure that the email address that you give to us is something that you have access to. If you're going out of town, make sure that you're able to check it. These are some of the things that we've had issue with in the past cycle, that someone has had a delayed response in receiving the email because they didn't check, and therefore their response was delayed. So please be diligent about checking that throughout this process.
So someone asked what would make someone not receive an award. That would be a reason why.
Sure. Eligibility criteria. If you give us all the paperwork that we're requesting, you fill out the application appropriately, but you are not eligible because you don't work at a participating facility, or maybe your dates of employment are not cohesive with what we're looking for. Perhaps you're not a full-time employee, but you're a part-time employee. You know, any of those eligibility requirements, if you don't meet those, you will not be eligible even if you submit the application in complete form. We anticipate that funding decisions will be made in late this summer, and all contracts are slotted to begin on November 1st. So that is in the very near future. Payment and reporting requirements, just so that you know what happens post-award. No advance payments are made. So if your contract is executed, we're not going to automatically issue a payment to you. We require that the physicians work for at least 3 months under the terms of the contract before any payments are made. So if your contract starts in November, December, January, February, you're not going to see any type of payment by the earliest is February or thereafter. Payments can be made quarterly or semi-quarterly at the discretion of the department. And there are some reports that we're going to require of you in order to execute those payments. So for example, we're going to get a employment verification form ensuring that you've in fact been working during that period in a full-time status, and that will be filled out by your employer. If the money is being applied to a educational loan, we may ask once a year for you to send us a statement from your loan provider showing that the money has been applied. So again, those monies, if they're intended for loan statements, they do have to find their way into and be applied to your outstanding loans. And then if you're a facility that may have different types of expenditures that you're paying out, we may ask for a report to support the expenditures before money is exchanged. The other large part of the application process, other than the questions in the gateway, are the attachments that you have to read and complete. And there are 10, which seems like a lot, but they're not all mandatory. So it depends on who you are and what you're applying for, what type of grant you're applying for. So first and foremost, we give you the New York State Grants Gateway Vendor User Manual, and that's just a reference. So if you're having difficulty navigating through the Grants Gateway, you may want to defer to that form and use it as a study source. The second attachment deals with site information. So if you work at 3 or fewer sites as a physician, then all of the site information actually gets entered directly into the gateway. However, if you're a physician that works at 4 or more sites, we ask you to upload that information as an attachment. So that's what this form is. There'll be very few people who work at 4 or more sites, but we do have a few. And so we put this method for them to gather that information for us in this particular place. Attachment 3 are your loan statements. So anyone applying for educational loan repayment would need to give us a loan statement that has to be 30 days current. So we're going to ask you for something that's recent, that shows your name on the statement and what your outstanding loan balance is currently. And we also want to make sure that you're current with your payments, that you're not in default. You can be in forbearance, but you cannot be in default. Attachment number 4 is the consent to disclosure. So if we're going to go look and verify your student loans, you have to sign a consent form saying that we're allowed to do that. So those attachments 3 and 4 go together in that sense. Attachment 5 is mandatory for all applicants. It's a copy of your employment contract or business plan. So we need to know where the physician is working. We need a copy of the employment contract for that physician that shows start dates. And also in that attachment, you'll notice that there is an addendum that we ask everyone to complete. And the reason why we've gone to using an addendum is because employment contracts vary so greatly that we don't always get consistent information from every applicant. So in addition to a copy of the contract, we do ask for an addendum, which is just on the company letterhead, signed by the physician and a representative of the organization, verifying the points that are listed therein, and we'll take a look at that later. The tool to identify an underserved area is attachment 6, and again, that is for everyone. So each individual applicant has to prove to us that they are working in an underserved area, and there's 3 different ways to do that. So we provide a lot of flexibility, and one of the next slides will discuss that in greater detail. If you are in a rural county or town, that is one method that you can use to identify an underserved area. So we provide that list to you. You would take a look at it. If you work in one of those towns, you could circle it and help provide that information to us. That's pretty straightforward. Attachment 8 is a placeholder, really. It's where all your documentation is going to be uploaded. So that's where everything is going to be returned back to us for consideration. Attachment 9 is an attestation form, as well as a form that identifies who the authorized representative is. We ask for this form because sometimes with organizations who are applicants, we need to know exactly who the person at the organization is. That's going to be our main point of contact. So that's where you would identify that. If you're an individual physician, obviously that authorized person is yourself. The attestation is there so that you're signing off and saying, basically at that point, everything that I have submitted in the Grants Gateway is true to my knowledge, and you're basically just signing away the truthfulness of all your statements. And attachment 10 is a vendor responsibility attestation. That is not mandatory for all applicants, and there is a section in the RFA that describes exactly who has to complete that and who does not. So we'll get into that later as well. So we talked a little bit about identifying an underserved area, and there's 3 ways, option A, B, or C. Please know that we only want you to select one option. If you choose to do 2 options, it does not give you any advantage whatsoever, and it just takes you more time. So choose the option that is most easily completed on your behalf and send that one option to us. I'll break down each option next. So the first option A is primarily for primary care or psychiatric physicians. So if you're somebody in primary care, meaning general internal medicine, family practice, pediatrics, geriatrics, OBGYN, or if you're in psychiatric care provider, if you are working in a HPSA, a MUA, or a MUP, you automatically qualify as an underserved area. And the link that is provided on this page, which you'll also see in the application process, will take you to a website that will allow you to plug in your address, and it will kick back and let you know if the address of where you work is in fact a HPSA, MUA, or a MUP. And you would take that application or that information that comes back from that database and send that back to us for verification purposes. The one thing I will say about this, there's been a little bit confusion. If you're a primary care physician, you have to be in a primary care HPSA. If you're a psychiatric physician, you have to be in a psychiatric HPSA. So a combination, does not work. You have to be directly aligned in the style HPSA of the medicine that you're practicing. Okay, go to the next page. Option B is again for primary care or psychiatric physicians, and this is where we get into the rural county or towns. So the state has identified what they deem to be a rural county or town, and if your county or town is on that list, all you're going to do is circle it and provide us with the actual address and completion and send that up as your verification that you are indeed underserved. Okay, let's go on to the next one. Option C is the most involved, and it is for anyone who is a specialist or anyone who is primary care or psychiatric that's not in a HPSA or a rural town. So it's kind of the all other category. There is a list of 17 questions in option C. You must be able to answer yes to any six of the 17 questions. Each of the questions provides directions on how you would provide supporting documentation to us. And again, when you fill out that attestation form, you're basically saying for some of these questions, I'm answering truthfully, yes, we've been looking for a provider for 6 months and have not been successful in recruiting one. Those are some of the questions that you see there. It can be any 6 questions of the 17. You do not need to answer more than 6. And again, this information will be uploaded into the gateway to verify that you're in an underserved area. Okay, that is it about that section. So again, just to recap, you have options A, B, or C. There's a lot of availability there. Please only complete one for us to review. In addition to the uploads, you then have the program-specific questions that are in the gateway themselves. These questions are very straightforward. Most of them are yes-no questions. You'll be able to go through rather quickly, and I think Jeff will show us a few of those questions live so you can see what they look like. It is mandatory if you're a facility applying for this grant, you have to name the physician who's working for the DANY service obligation. So you can't have an unnamed physician, or you can't identify a position, but you actually have to name the physician who's going to be doing the DANY service obligation. And again, that last bullet there just speaks to the fact that the applicant is attesting that these answers are correct when they fill out attachment 9. Okay. The work plan. As I talk through this, it's going to seem somewhat confusing, but Jeff will, again, go through this live with you. But when you get to the work plan section of the Grants Gateway, the objectives and tasks are already filled in for you in advance. So you don't need to do anything with that. You just want to read it and make sure you understand the objectives and tasks. And there's really only 3 things that you need to complete in this area. So where it says contract period or work plan period, you're going to put in the dates of the DANY service obligation, which are November 1st to October 30th. In the project summary section, all we're looking for is for you to specify the counties of service and your individual medical specialty, or the physician's individual medical specialty. And in the section for organizational capacity, you don't need to put anything in there, but you have to put in NA for it to let you advance from that field. So please enter NA. In the budget section, there are 2 different methods for completing the budget. And it's important to know that the RFA has a fixed term expenditure-based budget. I'll explain what that means in a bit, but first and foremost, if you're requesting funds to repay outstanding qualified educational debt only, then these are the fields and how they would be filled out in the budget. So in the field that says expenditure budget, you're simply going to answer repayment of educational loans. Under the justification field, we want you to put in the same thing, repayment of educational loans. Where it says total grant funds, this is where you're going to enter the amount that you're requesting. So if you have a large number of outstanding educational loans, you would be applying for the max amount, which is $120,000. So it's $120,000 for the 3-year term. And in the other narrative field, we're going to indicate the breakdown of the total funds per year. So if you're requesting a full $120,000 in that field, you would write $40,000 a year for 3 years. If the funds that are being requested are less than $120,000, then divide the total amount by 3 and enter that amount per year for 3 years. And that's what we mean by fixed term. So we're not going to give you $20,000 one year, $30,000 the next, $25,000 the next. It's a fixed term. You're going to get the same amount of money per year. So divide your request by 3. If you're requesting money for anything other than repaying qualified educational debt, it's slightly different. In the expenditure budget section, you're going to enter the information for the relevant budget items. There's any number of different categories that you can use there. Additional expenses can be included by clicking the Add button. So if there's an expense that you're looking to include in the grant and it's not there, you can certainly have it added. Again, we'll talk through this a little bit when in that section. In the narratives, you're going to provide a detailed justification for each budget item that you are listing. In the total grant funds, it's very similar to the previous section. It'll be no more than $120,000 for the 3-year term. And the other narrative is done in exactly the same manner. If you're requesting $120,000, then request $40,000 per year, so on and so forth. Default provisions. This is something that I want everyone to be very aware of prior to applying for the grant. We really are looking for individuals who are going to stay at these facilities for 3 years or longer. At the time of contract, you'll be notified of what type of source of funding you're getting, whether that's state funding or federal funding. But regardless of either method of funding, there are severe financial consequences if you leave your location before your service obligation is over. So just take that into consideration. There are reasons why your service obligation location may change, and we'll talk a bit about how you can contact us with questions if there's a change to your employment status. But we want to really encourage people that are going to be working in underserved areas consistently for 3 years. Applicants should be aware that the penalty for default would be assessed against the individual or the organization that holds the contract. So if the contracting party is the physician, then the department would reach out to the physician individually to pay back the funds. If the contracting party is the facility, then the department would go back to the facility if that physician defaults and say to the facility, you owe us these funds for non-completion of contract. The healthcare facilities that can request to replace a physician who leaves a facility before the obligation is complete, but you would need to contact the department to discuss the reasoning behind that and to get approval to make a change. Again, these are the types of contract modifications that we do allow. The decision to permit either of the following is at the discretion of the department. So a change of service location for a physician, it does happen that a physician moves from one employer to the next. In those instances, they would have to re-qualify that new location as being in an underserved area, following the same method as they did before, option A, B, or C. And they would need to let us know in advance of making a change so that we could approve or deny that request. Oftentimes, physicians have a reason to defer their service obligation If you're going to be out on FMLA for a reason, we will work with you. It happens often, and so if that's the situation, we will look to extend your service obligation for the period that you're going to be out. So please know that we will work with you on that. But the most important thing is to letting us know immediately and prior to any action, hopefully, so that we can talk the change through. Tax issues. Funds to support loan repayment may currently be exempt from federal and state taxes. You should not be issued a 1099 statement. And that's frequently a question that we received. Funds used for purposes other than loan repayment are currently not tax exempt. So if you're an individual physician and a healthcare facility is applying for a grant in your name, and the funds are being used for educational loan repayment, that's not taxable. But if the healthcare institution is applying for money on your behalf to pay you a bonus or a salary enhancement, that is not tax exempt. So, other scholarships and loan forgiveness. There are often people who participate in many different programs over time. So to address what DANY requires, you are not able to, no other state or federal loan forgiveness obligation can overlap or coincide with a 3-year DANY service obligation. So if you had an obligation in the past and it's complete, not an issue, but it can't be concurrent with our grants. And the only exception is if you're in the public service loan forgiveness program, that can run concurrently with our program, and that's the only program to do so. If you've previously participated in the DANY PLR or PPS program, then that physician is not eligible to apply for another cycle. So once you get DANY grant funding, it's a once and done thing. You cannot reapply. This talks a little bit about the contract addendum letter that I mentioned previously when we talked about the employment contracts and how different employment contracts can be. So we ask you to provide an addendum letter that gets us all kind of on the same playing field. And what we ask is that the identified physician, these are the points that we ask you to summarize in the letter, that the identified physician is going to work for the 3 years DANY service obligation for the dates of November 1st, 2019 to October 30th, 2022. We need you to provide the name of the facility where the DANY service obligation will be served and the percentage of time at the location. So some physicians may be working 50% at one location, 50% at another. We just want to know how those percentages play out. We need you to confirm that it's a full-time working status, and we identify full-time as 40 hours a week with a minimum of 32 clinical hours and a minimum of 45 weeks a year. And we identify that any on-call hours can be used only if it is regularly scheduled and the physician must be providing patient care on site. One new addition that we noted in this cycle, because we did have previous applicants with this caveat, but we addressed the issue of a telehealth provision. So for those who are working or providing some telehealth services, we look for you to know and understand that no more than 40% of your time can be in telehealth, really because we want to ensure that at least 60% of your time is hands-on, direct face-to-face patient care. Okay, so that went quicker than I thought. The webinar link, this webinar link will be made live shortly after this event so that you all can go through this again and revisit or pass this information along to anyone else that you feel is interested. Again, all questions that we don't address today, if you have them come up today, tomorrow, next week, please email them to us at the DANY email inbox that's listed here, and be mindful that we need to receive everything in writing by the 21st of February. After the 21st, I am only able to answer technical questions. You know, how do I find the grant and the gateway, those types of things. And all the questions and answers will be posted both in the Gateway and on our website on February 28th for everyone to share.
Someone asked, what's the percentage of approval versus application, or does everyone who meets the criteria get it?
It changes with every cycle because every cycle we have a different number of applicants. I can tell you with cycle 5 that everyone who met eligibility criteria was able to be funded, and we were very proud of that. So last cycle we thought we would be able to give out 75 grants, and we were fortunate enough to be able to give out 100. So everyone that met the criteria was successful. I can't guarantee that that will be this way for this grant. For cycle 6, we're looking at giving out 75. So again, if you can get your application in sooner, that's better. Right, and you may be waitlisted. So previously when we were speaking about there being a total of 3 grants at a healthcare facility location, if you're applicant number 4 or 5 and you meet all the eligibility criteria, then we will put you on a wait list. And if for any reason grantees 1, 2, or 3 drop out, we will go to the wait list and pick up the next eligible applicant at that location. Yes, and we will have a wait list beyond 75. So if we get more than 75 people who apply and we can only fund 75, 76 and beyond will be put on a wait list should more funds become available.
So even though they were able to award essentially everybody last year that applied, don't think that's going to be the case this year. You still really, you're best served if you submit your application as early as you can, starting on March 7th. So before I go to the Grants Gateway, I want to go to that Grants Management website that I told you about. So it's grantsmanagement.ny.gov. All right, I'm going to just zoom out a little bit here. So this is our website that's designed to help you get through pretty much anything you need to do in the Grants Gateway. It's organized based on the type of thing you're going to be doing. So you can see the menus here for getting started, how to search for funding, how to register, how to get pre-qualified. We talked about all those things in the PowerPoint there. So register your organization. And if we scroll down in here, we can see there's an overview, how to register, form instructions, and the actual form itself. So there's the form. We talked about the substitute W-9 form if you need that. If you're an organization and you need to provide an organization chart, here's some examples of what one would look like, a sample. And again, remember, if you're an individual, we want your resume. So that's registration. And if I go back up to the top here, there's also a section about how to apply. So I would really not bother with that because this webinar is more direct to this specific one, but generic information about how to apply for a grant is right here as well. There is and again, get pre-qualified if you're an organization and not-for-profit. You need to worry about that. You have to be pre-qualified prior to April 4th, which is the deadline for this grant to be submitted. Some other links for training and guidance, FAQs and things like that. And then there's a direct link to the login gateway right here as well. If I click on that, this is where you'll be going eventually to the, I'm going to do that back in Internet Explorer here, to grantsgateway.ny.gov. One thing I always like to point out, it's not www.grantsgateway. If you were to type in www, you see you get this error. It's just because the way the state sets up their secure websites, they don't do it on the www version. They just do it at HTTPS and the address. So just go to grantsgateway.ny.gov. And when you go there, you're brought to the portal. You can see it says Portal Home. And this is just a page that anybody, even without logging in, anybody in the world can go and look to see what's out there in New York State as far as grant opportunities. So if we were to go backwards on this page here, registration, there's another link to that registration form I talked to you about. Request access now, here's the form, here's the W-9 form, and so on. Notification, it's a little late for this. Actually, no, it's not, actually, because we haven't posted this one officially in the gateway yet. If you were to go here to sign up now and put in your name and address and organization and signed up for, do you remember what we called it? What type?
We called it Workforce Development.
Okay. Or just pick all of them.
Yeah, I can pick all of them.
You'll get the email the moment that I push the button to make this grant live on March 7th. So you already know about it, but if you want to be alerted of new grants that are posted or when this one is posted, that'll do the same thing. It'll send you an email with a link to the grant opportunity. So that was, again, from the portal homepage, not logging in yet, and notification. And then you can browse or search for grant opportunities. I'm going to search, and I'm going to look for the word doctors. This is what's out there now. It's not the opportunity, it's an announcement. So remember, we haven't posted it. It's not live yet, but if we were to click on this, Doctors Across New York, DANY, Physician Support, Cycle 6, this is what may have directed all of you to come to this webinar right now, because this is the information about it. It's kind of hard to see on my shrunken screen here. It's even worse now for me. But down here on the bottom is View Grant Opportunity, and that's how you see the RFA. So Carolyn's been talking about the RFA this whole time. This is the actual document. I click on it, and I click on Open. And I wait for it to download. And here we are. So it's 177 pages. I'm certainly not going through them all right now. But you need to refer to this. You need to be aware of everything that's in here. It talks about the actual questions that you're asked. It talks about the attachments that you need to provide, the eligibility, all that information that we went through in the PowerPoint. That's all here, and this is obviously your guiding document for how to apply and what to do and what's eligible. So I'm really not going to go through a lot of details here. What was the one thing we were going to say? Was it
about the application limits? About how many people could apply per facility?
Yep. So basically, all the questions that you guys have asked so far, or most of them, can be found here. Look through the table of contents. Again, I wouldn't just browse this. I would go through the whole thing and pretty much read the whole thing. Some of it talks about what happens if you get awarded a contract, and the majority of it is leading up to and applying for the grant opportunity. All right, so I don't think it's worth spending too much time in here. You should really do it yourself in getting through. If we have a question as we go through applying here, we'll go back to this document. All right, so I want to apply now. Now, if you were going to apply, you would click on the login button here, and you would type in your username and password. So again, you would have had to register first. You would have received a username and password email from the system. One email says this is your username. The other one is your temporary password. You go in, you change your password, and you're good to go. But if you're the grantee delegated admin, you can't apply until you go in and change or create a new account for yourself or somebody at your facility to be able to log in and do that. So I've already done that, and I'm going into our test system here, and I'm going to log in as someone named Barbara Signatory. So she is a signatory. She's a grantee contract signatory. And she logs in. It says, welcome, Barbara, and it confirms that, yep, this is the role you've signed in as. And we do know that this is one of those roles that I said can apply for a grant. So this is the layout of the grants gateway. Up on the top, I'll call it the search options. You could go back to the portal and search the portal. You can search for any applications your organization or you personally have already started. You can search for contracts that are in your organization's name, payments that you've made, which if you're new, you certainly wouldn't have any of those. Progress reports, same thing. If you had a contract, you might be using those. And tasks you wouldn't have until you have a contract. So really, you would search for applications if you want. The black bar here is kind of reference or kind of site management. There's a link to some training materials, or one in this case. Information about your organization. So if you wanted to set up a new user account, this is where you'd do it. You'd go to organizations, and I have two. Let's just pretend we have one. And you would go to organization members. And if you were the right type of user, which I am not, there would be a button here for add members and then new members, and you could create a new account. That's in the user guide that we have. That's also mentioned in the RFA, I believe, as well, and also on the grants management website. So organizations is where you get going to set up the people in your organization. Profile is your personal profile. If you need to change your email or address or whatever, log out would obviously log you out. So let me go back home. The blue bar here is kind of an action bar right here. Right now there's no actions we can do. You might have noticed there was a save button there before on the other page I was on, and that'll appear on pages that you are allowed to enter information in and save. So we'll do that in a few minutes as we get into our application. So Barbara doesn't have any applications that she's started now. She doesn't have any tasks. So my tasks would be an option for some people if you already have an application started or you've got a contract. But you can see down here in the bottom, there's no section called My Tasks. There's My Inbox. You can ignore that. It's just a copy of of any emails you might have received from the system. So what you care about to start your application is this: View Opportunities. So a lot of people call us or email us at the help desk and say, I went to the portal, I found it, but it doesn't let me apply, because that's not how you apply. The portal is just for viewing. To actually apply, it's you log in, and from the home page you go to View Opportunities, and you search for it here. And again, I'll search for the word doctors, and I find there's one opportunity with the word doctors in it, and of course that's this DANY Cycle 6. We know that it's available right now. Yours will really say availability date March 7th. I just happened to post it today. And it's due April 4th at 4 p.m. So let's click on it. And this looks pretty much similar to what we showed you a few minutes ago in the portal. The difference being, instead of looking at the RFA here, here's your button to start your application. So it does on the right here mention, again, that due date and time. Talks about, again, that there's $9 million available. Awards are up to $120,000 each, the 3-year contracts, and so on, all that information we talked about. One of the things that Carolyn mentioned was the Q&A, the questions and answers. This page right here and the corresponding page that we saw in the portal will have a link to the Q&A document that she uploads after or on the 28th of February. So look for a link right here. That'll get you to the Q&A document. Everybody's question that was asked will be in that document and will be answered in that document. So in the pursuit of fairness, that's what we do. We want to show everybody's questions and an answer to everybody's question. The other thing on the bottom here is what drives that email that we talked about if you signed up to get notified. So Carolyn said workforce development. It also was set up for education supports. So if you had signed up for alerts for either of those two items or all, you would get an email on March 7th when we post this. All right, so let's say today is March 7th, and she goes in here and she sees it and she wants to apply. We click on Apply for Grant Opportunity, and we are now in an application. We are the first applicant, so it's application 00001. So you can see the application number is just the ID number of the grant dash a 5-digit number. I had clicked on this details button inadvertently, but that's what you're going to do to just see, you know, this is just information about it. This is my organization's name. If you're an individual, it would say your name there. I'm in the right role, grantee contract signatory. I'm in the application in process status. Obviously, I just started it. And I have a due date, of course, of 4/4 at 4 p.m. All right? There are buttons on the top here. Menu. It's not really menu. What it does is bring you back to the page we're on here, the application main page. You can see it's blank right now because obviously we haven't done anything, but eventually it'll fill out with this information on the bottom. Next is the forms menu. You're going to be spending all of your time in there. That's all the forms and documents you need to fill out for the application. So we'll do that in a minute. Status change. Eventually she's going to want to submit this, and you can see that's one of our options here, application submitted. If you tried to do that and your application wasn't complete and you missed some of the required fields, the system would give you some errors and say, wait a minute, you can't submit it until you fix these errors. Under management tools, you can also check for errors. So we'll do that a little later. You could add, edit people, probably not something you need to do, so I wouldn't worry about it right now. And then progress reports and related documents, that's something that's used in some contracts after a contract is awarded. Obviously, we're just in the application phase now, so that's not going to be relevant to you right now. So back to that forms menu, that's what you care about. You could hover on it and scroll through, but I would suggest instead you just click on the word forms menu and you see the whole forms menu here. Okay, so we start out with, this section is the contract document properties. This is just for your information only. If I click on it, I can see a sample contract. It's called the Master Grant Contract through the state. It's the same template that's used for all contracts in the state. If you cared about what it looks like or what the terms and conditions are, you could look at that. There's an attachment A1, which is the program-specific terms and conditions, specific to DANY and specific to the Department of Health. you could click on View File here to see that. And if there were any other documents related to this, you'd see them down here. Again, these are all documents that would make up a contract if, after you submit your application, you are awarded a contract. So just for your information only. The next part is application information, print application. Well, we haven't done anything yet, so there's nothing really to print. There's another link to the RFP. RFA we call it, but it's kind of hard-coded in the gateway to be RFP. For those of you that don't know, RFA, request for applications, RFP, request for proposals. Application versions. After I submit my application, it'll package it up all in a nice, neat PDF, and that will be available here in about 5 or 10 minutes after I submit my application. So here's where you start entering in information. You need to provide us your project site address. Really, where are you located? Where are you based out of? Where is it being managed out of? And you may have several. I'm going to defer to Carolyn here. I don't think that's a big deal to you, right? Because they're going to identify it down below.
They'll identify their individual work sites down below.
Yeah.
We just want their primary site contacts there.
So you don't have to go crazy and put in, a bunch of different sites here. Your primary is fine because you'll get into the program-specific questions and give us details if you have other sites or about your site itself. She talked about the budget, and we're going to fill out a budget in a few minutes. I'm going to be just a single physician applying, so I'm going to put all my information here in other. But if you were a facility, you might have a couple other things that you'd fill out here, and you wouldn't just use other. The work plan we talked about, I'll go through that in a minute, but I really wanted to get to the pre-submission uploads first and start with that. So certainly you can go in order, starting here in program information, but let's take a look at these uploads because there's documents here that'll help us along the way with our application. There's that user manual. So remember, in the PowerPoint this was listed, and in the end, I think it's in the end of the RFA itself, it talks about these and explains what they are. So first one is the vendor manual if you want some help with the gateway or overall information. Attachment 2, site information. This needs to be completed and uploaded by the applicants submitting a 4th and subsequent practice location sites. So remember, Carolyn said that we give you up to 3 in the program-specific questions. If you had a 4th or a 5th, you'd put them here. All right, so it's just a template. I didn't even look at it, but I'm guessing it asks for location. And so site number, if this is 4 of 6, site name, site address, and so on. All right, so if you were doing one of those, you'd fill it out, you'd save it, and then you'd click on Browse here and attach it. Loan statements. Eventually, maybe not up front, but at some point before you submit your application, you have to attach your loan statements. So we're going to click here on Browse and attach it. And let's say I have one saved. I call it sample attachment. You would click on it, you'd attach it, and then eventually when I hit Save, it'll become part of my application. Consent to disclosure. So everybody has to fill out this.
Who's asking for loan?
If you're asking for loan repayment, so it's not a red asterisk. It's not required. But if you're asking for loan repayment, you would click here, get the template, read it, and fill it out, save it, and then back to the gateway, attach it here. So I'm just going to, again, attach that sample attachment, not the real document. You, of course, would attach the real document. You need an employment contract or business plan. We give you a template for that as well. You can see that's a red asterisk. So we click here. You can open it up. And this is a document that Carolyn talked about earlier. Fill it out, save it, attach it. All right. Now, I'm going to hit Save first here, and it's a good idea to hit Save periodically for a couple reasons. Number one, the Grants Gateway will log you out after 20 minutes of inactivity. So me just going here and clicking Browse, it's seen as inactivity because I didn't save the page or I didn't change my page. So after 20 minutes, if I sat here and I clicked Browse and I attached all these documents, and then I got a call or I walked away from my desk and 20 minutes passed, I'll come back to my desk and it will have logged me out, and all that stuff I did before I hit Save is now gone. So you can save it and you see you get an error. It says, wait a minute, you didn't do attachment 6, 8, or 9 because those are required. Well, I know that, that's fine, but I can come back and work on this another time. At least it saved what I just did. So let's go down to attachment 4. Notice the things that I did attach already, it says view file because it shows me the document I attached. So let's just double check. This one was attachment 3, my loan statement. If I clicked on view file and I open it, and of course mine just says sample attachment, yours would be the document you uploaded. So you can verify that, yep, that's the thing I intended to put here in number 3 or number 4 and so on. All right, so the tool to identify if you're in an underserved area. We'll click on it. So here's that tool. We talked about option A, B, and C. Okay, I just wanted to clarify. So you are filling that out. You are now saving it and attaching it here. So, okay, I filled my tool for underserved area. I have saved it, and I'm going to attach it here. You're also going to prove that you're in an underserved area by filling out attachment 8. So remember, there was attachment 7. If you're a rural county and town, and Carolyn said just you can circle it here. So if I look at that, we can see it's just a list of the counties and the towns. So that's pretty simple. If I had that, I could do that, print it out, circle it, and attach it here. But then I also have to have this supporting documentation, attachment 8. I click here. Here is a template. I'll open it up. And it's just a placeholder. But we want you to provide a document that supports your claim that you're in an underserved area. Now, I say a document. You could have several documents, but you really do have to combine them into one PDF because the gateway here only has room for one PDF in this section. So fill it out or provide documentation and then attach it here as one document. All right, there's the attestation form we talked about. You're going to click on it. Again, open it, fill it out, save it, and attach it here. And then the vendor responsibility attestation, I'm sorry, explain again.
Organizations have to fill that out,
okay.
Or anyone requesting more than $100,000 of the life of the grant. So they'll walk you through that.
Yep, and that's explained in the RFA. And we'll hit save. All right, so I did all the required ones. Couple that were not required because I did the, I guess, let's say I did the rural counties and towns as well. So obviously you're not done with your application, but that's a good part of it. And again, I would definitely double check by clicking on View File that what you've uploaded here is what you intended for attachment 8 and 7 and so on. All right, so that's pretty straightforward. We'll go back to the Forms menu. And I'm just going to go in order now. So that was good to get you an idea of, have you answered the things, have you verified they're eligible, because there's kind of no point in going through all these questions if you get to those and you realize, oh, my town is not in the right area. So now that I've determined that I am qualified, let's go through in order here. So project site addresses, again, it's just kind of where you're based out of, what's your home site. I'm just going to say Barbara's location, and it's 123 Main Street, and I'm just putting in Albany. Obviously, I don't know if I'm qualified or not, but you'll figure that out. Now, there's two fields here, Regional Council and Agency-Specific Region. Regional Council, we don't need you to fill out. You can leave that blank. But Agency-Specific Region, we do want to know if you're in New York City or rest of state. So that, even though there's not a red asterisk, it is a required field. If I hit save here, it does give me the error saying, wait a minute, you have to fill out agency-specific region. So let's do that, and let's say I'm rest of state, and hit save. That's for when your applications are reviewed, so they know kind of what bucket to put it in. All right, let's go back to Forms menu. This is the other big part. It's the program-specific questions, and we'll click on that. And you can see as I scroll through here, there's a lot of information here. But it could be pretty quick because there's a lot of yes-nos. We start off with the project title, and we give you the project title, and that is this, Doctors Across New York Physician Loan Repayment Program, Cycle 6. So I'm just going to put that in there, and you don't have to type anything different in there. If you were to be awarded a contract, this title will be on the cover page of your contract and on several other pages. All right, so what's your name? What's the name of the applicant? So I'm not going to fill everything out here. Address, here is the address. Name of contact person, name, phone. Email address. Status of applicant, not-for-profit or for-profit. If you're an individual physician, you should select for-profit. So I'll say for-profit. So indicate the type of applicant. Now, in this section here with 1H, the applicant named above must match the type of applicant selected below. So we are going to be one of these. Either we're an individual physician, in this case, yes. So that means I'm not a healthcare facility. I'm not a healthcare facility located, operated by, or licensed but not operated by OMH, OASIS, and I'm not a PC or PLLC. So we expect all of you will have one yes and all the rest no's from 1H through 1L. If you have more than one yes, you've done something wrong. Okay, part 2, physician identification. The questions in this section refer to the physician who will be completing the DANY service application. Again, physician name, physician title, MD or DO, mailing address, phone number, email, specialty. You can see now I'm going faster, just typing junk. How many, so part 3, facility identification. This refers to primary facilities where the physician will be practicing when fulfilling their DANY service obligation. All right, so.
Hopefully there's not 123.
Yeah. Percent of time, primary facility is in a HIPSA. Is that usually a yes? I don't know.
It can be.
Can be.
Yeah, it's not a mandatory field to provide the number, because if you're not a HIPSA, then
Yep.
you won't provide the number.
Right, so if you pick no, you wouldn't be putting in a number here. And I think you said this is a 2 or 3 digit number.
Mm-hmm.
So again, I'm not going to go through all these questions. You get the point. There's yes, no questions. There's questions that require you to enter in a number. There's questions that require you to enter in text. So I'm not going to do all that directly here. These are not required. If there's not a third here, you just type in none, because 3R is a required question.
And I would recommend that if you print out the program-specific questions from the RFA and write your answers down in advance, it'll help you when you just process, because then you're just, you know in advance, copying and pasting what you're answering. Yep.
So the RFA has the questions. You've got between now and March 7th before the applications are available. You might as well do your homework ahead of time, fill it out in a Word document, be ready to go. So on that day, all you have to do is log in. You've got all those documents that I just downloaded ready to go. You're ready to just upload things and put in your answers, and you could do it quick. Now, of course, you don't have to be number 1. You don't even have to be number 40 in most cases, or 50, or maybe even 75. But you want to do it, as early as you can. All right, I'm going to go through. If there's fourth or other, we know that you have to put that in the attachments. I don't have a fourth. What are the use of funds here? Is it for a physician's repay outstanding qualified educational debt? Yep. To establish? Nope. Joint medical practice? No. My healthcare facility? Nope. So again, in 4, there's A, B, and C. You're probably only going to answer one of those as a yes. If you answered more than one as a yes, that's a problem, right?
Mm-hmm. Correct.
Okay, 5. If you have to answer yes to all of these. So are you a U.S. citizen, permanent resident, holding an I-155 or I-551 card? Yes. Okay, these all have to be yeses. So that's another thing to look at. If you, ahead of time, look through these and you realize, well, I'm a no on that, it's probably not worth you applying. All right, we're going to do some more yeses here. Will you be in full-time clinical practice?
Okay, so these are all eligibility criteria. We need you to be answering yes to all of these, and then the attestation covers, obviously, the viability of your answers.
The fact that you're attesting to yes, everything I said here is true.
Right.
This is
and this
no.
section, we're looking for answers. You must be able to answer no to each of these questions.
So that's starting in 5Q, and Q through V should be no's. So don't just randomly put in yes, yes, no, no. Read them and make sure that it really does apply to you. And V. Okay, part 6 is your current status. So are you currently licensed to practice? Yes. And then provide license number. And if not, provide date license application was submitted.
And that's important to note that you can be in the process of getting your license as long as you're licensed prior to the start date of the grants, which is November 1st.
Okay, are you a resident? What's your medical specialty? Anticipated start date? This will be within that window that we talked about.
Right.
So I'm just going to say, what can I say, like 10, 15?
10, 15, 18. It has to be before November 1st, so.
Yep. All right, part 7, scholarships, loan forgiveness, physician received Regents scholarship. Again, you're going to answer these correctly. I'm just going to put in junk here. Yep. Part 8. So this is just us making sure that you understand that there's some things you should best practices you should deal with before you submit it. So do it at least 48 hours prior to the deadline. Otherwise, if you wait till 3:52 on the April 4th and you realize you forgot to answer 6 questions here and you submit it and you get all these errors, do you have enough time to take care of them? So we want you to try to do it ahead of time. We don't anticipate, and we never really have any system problems, although people will complain to us and say, I had system problems, and we can look at your date and time stamps to see that's not true. They actually didn't log in until this time and started at, at 1 o'clock on that day. So there's really never any system problems with the gateway. It's usually user problems, and we want to make sure that you do it ahead of time. Must be submitted electronically prior to April 4th at 4 p.m. Only the people in the right roles can do it. So if you get to 8C and you've never heard of that before, that's a tip-off for you to say, oh, I better be in this role or this role. Late applications will not be accepted. So again, you can't hit the button at 4:01 and expect that we'll take your application. The system will have locked you out from submitting an application at that moment. And you must be pre-qualified. If you're an individual, you still say yes, but you don't have to be pre-qualified because that's only for not-for-profits. And explain this. I haven't read this one yet.
You attest. Attestation.
Yeah, this attestation. So by responding yes, you're attesting to this. So read it and attest to it. All right, you know what? I'm not going to answer this one. I want to leave at least one of them unanswered because I want to have a problem when I try to submit it. Okay, the next part, these are not questions you have to answer. It's telling you, you got to make sure, do the budget and do the work plan. So if I was to read this, it's going to explain to me that I need to put in for $120,000 because I'm doing, or a max of $120,000 because I'm doing an individual loan repayment. So this explains what's allowable in the budget. There's obviously a lot more detail to it in the RFA itself. So I think I'm done here. I'm going to hit save. You probably should have hit save, again, every 5, 10, 15 minutes through that if that took you longer. Some of your questions you were copying and pasting from a Word document or something. So, it could have taken you longer. We don't want you to get logged out without hitting save. So save every 5 or 10 or at most 15 minutes. So I saved it, and I realized I got an error with question number 8F. Let's just ignore that for now. We'll have that become a problem for us later in a few minutes. All right, 2 more sections. I went back to the forms menu. I noticed there's that error, but let's pretend I don't notice. And I have to go to my budget. So there's all these different budget categories: personal services salary, fringe, contractual, travel, and every category has a narrative as well. Now, if you're a facility, you might have some of these other fields to fill out. I'm not going to go through that unless Carolyn has something specific she wants me to say about it. What I'm going to do is I'm going to fill out other because I'm an individual physician applying for this. So I go to other expenses detail. And remember, the PowerPoint and the RFA tells us what to put in, which is repayment of educational loans. So I'm going to put in repayment of educational loans for the type and for the description. And how much am I asking for? So it's $120,000 max. But remember, if it was, you can ask for less if you need to. And we're going to divide that by 3 when we put in our details. So I'm going to put in $120,000 and hit save. So that's pretty simple. That's all you have to do here if you're a physician. Put in those statements or those titles that we gave you and type in $120,000. The other thing you have to do here, I could hover and go to it, but I'll just click on Forms menu, is we want you to fill out in the narrative the text you were given in the PowerPoint and in the RFA as well, which is basically doing the math. So I just wrote that here, $40,000 per year for 3 years. So that's what I'm going to put in here, $40,000 per year for 3 years. If you were requesting $90,000, you'd put in $30,000 per year for 3 years. All right, so I'll hit save. Okay, that's very simple. And if you're a physician, that's it. You're done with the budget section. If I was to look at this expenditure summary, it's going to tally up all those fields that I filled out, which of course was only 1. And we can see that I'm asking for a total of $120,000. I do remember there's one thing I wanted to point out based on what Carolyn said in the PowerPoint. And that is, if you're a facility filling out some of these items and you need more than one of them, that's fine. Every one of these categories has, remember I clicked the Save button to save it, but they also have an Add button. So if I filled out one line and I need to fill another, in this case, Other category, I click Add, and I've got a blank entry for Other to fill it out. You can do that with salary or travel or whatever it happens to be. For a physician, you're not doing that. For a facility, you might need to. All right, so I didn't need to do that. So I'll go back to the Forms menu. And our last section to worry about is the work plan. So we talked about the work plan overview form, and then it's got the 3 sections: the date, the summary, and the organizational capacity. So the date is 11/1/2019 to 10/31/2022. I'm going to skip, we're going to do the summary and the capacity, and I forget exactly what it is. Right, so it's your counties of service and your medical specialty. All right, I'm just writing this. You will actually write the county or counties and the medical specialty. That's all we need here in the project summary. And remember, organizational capacity, we don't need you to give us any information for that. It's not required here, but it's required on the gateway because of this red asterisk. So just type in NA for that. So again, this page is pretty simple. The work plan period, the counties and your medical specialty, and then NA. So we hit save, and we're done with that. So we'll go back to the Forms menu, and the last section here is the work plan properties. And we can click on that and notice that there's nothing I can do. It's all grayed out. So remember, the RFA tells you this is all pre-filled out for you. So it just shows you the objective name, the task name, and a performance measure. So these are required in New York State grants. And in this case, it doesn't have to be completely detailed. So this is all the information we need. All right, so I'll go back to my application. I've actually clicked on the main page. And you can see now it's filled out some of these fields here. It filled out my name and the amount that I'm requesting here. So I think I'm done. We know we're not because I forgot to answer this one question, but let's pretend that we think we're done and we're going to go through. I would double check it though before you submit it. So one way of double checking is going up to application information and doing this print application. So we click on it, and you don't have to print it. You can save it as a PDF if you want, or you can just look at it on your screen. So I'm going to hit cancel when it asks me if I want to print it. And this is kind of a linear layout of all those pages we went through and everything that we put in here. So all those questions, here's all my answers to it. I might want to double check this and make sure that I put everything where I intended to. Then it goes into the budget. Now, of course, I didn't have anything for salary or fringe, but if I scroll down to other, here's other, repayment of educational loans, $120,000, and then there's the narrative. Where's the narrative? Right here, $40,000 per year for 3 years, and then there's that summary that's $120,000. Work plan overview, the dates we filled out, the text I filled in, my counties of service and medical specialty, and my NA in organizational capacity. Remember, objectives, tasks, performance measures, you didn't have to worry about. And it goes in and it tells you the pre-submission uploads, those attachments we did at the very beginning. Unfortunately, you can't just click and get the document that you've uploaded. So remember I told you in the gateway, in the pre-submission uploads, you should click on the View File to verify what you attached is what you intended to be there for that specific one. All right, so I think I'm done. I've done that preview. It looks good to me. Of course, we know that we forgot to answer one question, so I'm going to try to submit it. So status change, I can just hover over it or click it if I want and go to application submitted. And it does that error check and it says, wait a minute, you missed question number 8F. So again, if this was 3/59 on the due date, I'm going to be scrambling to get that taken care of. So I'll click on program specific questions. I'll go down to 8F. And of course, that one's just a yes, no. And yes, I do understand this. That's my attestation. I'll hit save. And now I should be able to submit my application. All right, status change, application submitted. It brings up this attestation or agreement, basically saying you're allowed, you are who you say you are, you're allowed to submit on behalf of your organization, and you haven't given your password away to anybody. And I click on I agree. And in a couple seconds, my application, there we go. My application was just submitted. All right, so how do I know it's been submitted? A couple ways. Number one, you'll get an email in about less than a minute. Number two, you might remember the status we were in. We were in application in process. Well, now it's in the status of assignment of reviewers. That sends it to DOH and to the program group. And starting on April 4th, they'll start looking at these applications, or April 5th, I guess. One other way of knowing it is of course, that I don't have the ability to work on it anymore. If I went into the Forms menu and I went to one of these fields that I filled out already, like the other narrative, sure, I have the ability to type anything, but I don't have a save button. So your save button is gone because you've submitted it. Now, it's not too late. If you're before the deadline and you submitted something and you realize, you know what, I really wanted to explain something better, or I just double-checked and I did this wrong, you can check with our help desk. We can send it back to you and you can resubmit it, as long as it's before that deadline. Now, remember, if the program group at DOH goes through your application and finds problems with it, they're going to give you 10 business days to fix those in that one email. So you'll wait till after it's been reviewed and you'll get correspondence from DOH. 5-10 minutes after you submit it, you go to the Forms menu and you can see application versions. You don't have to do this. I'm just letting you know that's where your complete application is. This is what the program group will be looking at when they review your application. And if I click on it and they open it, it's a cover page, when it was submitted, what application number it is, what I called my program, how much I'm asking for, who submitted it and when. This is just a copy of that submission, of that attestation I made. Project site address, not really having any bearing on your application, but then the actual questions and answers. And as you can see, it's a heck of a lot easier to read here than in the gateway. So that's why we have the reviewers look at this document. So I'm going to just quickly scroll through these. Obviously, all my jumbled characters answers. All right, so then we get into the budget. There's that budget overview that we saw before and the $120,000 that I'm asking for. And here's the specific line items that I asked for. The repayment of educational loans, $120,000. Here is my justification, and here is my narrative, that $40,000 for 3 years. Here is my work plan, the name, the counties that I put in here, the dates, and work plan detail, which remember you didn't have to fill out, was pre-filled out for you, and then that organizational capacity where we typed in NA, and then all my attachments. And of course, these are all just one document that says sample attachment. These are your real attachments. Let me say one other thing. I should have said this before people started dropping off the call. But the attachments, we prefer PDFs. Word documents are fine. Excel documents are fine, but we prefer PDFs. And they cannot be password protected. So if you put in a password protected PDF, this generation of this application PDF will fail. That doesn't mean your application is going to fail. We won't penalize you for that, but it just makes it harder on our reviewers and harder on me because I have to deal with it. So just try to not put in any password protected. So if you're putting in a loan statement, you might have downloaded a PDF from your bank. That could be a protected file. Make sure that it's not. There's an easy way of doing it. Maybe I'll put it in the Q&A. I'll have Carolyn put it in the Q&A. All you do is you view it in Chrome, and then you do file print to PDF from Chrome, and it'll actually strip out the protection. It doesn't seem very secure, but that's how it works. So I'll put that down there because we really don't want you to do that. We don't want these PDFs to fail and cause us a little extra work. Again, it's okay if it happens, and you're not going to be penalized for it, but we'd prefer to just not have to deal with that.